Good morning, good afternoon, or good evening, class. I am here to talk about Legislative Document 657, which poses a potential solution to a social justice issue that I feel passionately about. LD 657, an act to provide enhanced mental health services to the county prison population, proposed to increase funding for mental health services in prison. This includes educating and training prison employees in behavioral health assessment and protocols on an annual basis, and would also require an on-site mental health worker at every county prison at least 8 hours a day. This would address the recognized social problem of the large mentally ill population in prison. The larger social issue, the criminalization of mental illness, is not addressed in this bill. While I agree that the mental health needs of those in prison must be addressed, especially considering that 95% of county jail prisoners eventually return to the community. Even with enhanced mental health care or an on-site mental health worker, prisons are still not equipped to adequately meet the mental health needs of prisoners. There are other solutions that would help move away from incarceration and towards treatment. Since the deinstitutionalization of state mental health hospitals across the United States in the 1960s, many of those who could be benefiting from treatment are finding themselves in the criminal justice system. Nationally, an estimated 31% of female and 14% of male inmates live with serious mental illness. Those with mental illness spend on average 215 days in prison, while others spend 42 days incarcerated. Once released, due to lack of formal support, the recidivism rate for those with mental illness is 54%. This history has left Maine in the same situation as many other states across the country, a warehouse for Mainers suffering from mental illness and addiction. Mental health courts have grown over the last decade and shown success in several studies. Mental health courts allow participants to avoid incarceration for nonviolent crimes by complying with court-mandated treatment. According to research from the RAND Corporation, mental health courts have successfully decreased the number of mentally ill individuals in prison and increased the number of those receiving community-based mental health treatment. Also finding that the decrease in jail expenditures was offset by the cost of treatment services. Other studies show that participants in mental health courts were less likely to obtain new charges, show a decrease in substance use, improve their independent functioning, and spent fewer days in jail. Therefore, Maine should not only look toward enhanced mental health services in prison, but also use these models of mental health courts. Mental health courts are a way to invest in people by providing them with the support to live productive and meaningful lives. Legislative Document 657 started the conversation around a crucial social justice issue that the state of Maine is facing. The bill died in between houses on June 4th. The bill dying does not mean that the conversation has to die with it.